Professionals with careers in health-related fields. We hope meeting professionals that look like us and come from our similar circumstances and experience, we will create a pipeline of future scientists and health professionals, that you would grasp in your minds the possibility and pursue a career that will eliminate health disparities. As you know, there is a need for diversity at all levels. We hope to pique your interest and inspire you to follow professions in these fields so you can add yourself to those that make a constructive and positive contribution to our communities. All voices need to be heard, and we continue to need to diversify. So step up. We want to thank you for our sponsors, our guest speakers, our panelists, our volunteers for making this day possible. Students, enjoy the day, ask questions, learn, and be transformed. Remember, as we say in Spanish, si se puede, yes, you can.
Good morning to all of our students, our panelists, our speakers, our sponsors. We are so excited to have you here this morning, this long-awaited day that we could have this symposium in person again. We've done it virtually, but there's nothing like being here in person. So welcome to everyone. My name is Marilyn Marsh. I'm the Executive Dean of Esperanza College of Eastern University. Esperanza College is a branch location of Eastern University. Our students at Esperanza receive a private faith-based education right here in North Philadelphia, where we discount tuition so that students in these neighborhoods can come to this college to receive a private school education and matriculate on through their bachelor's degree at Eastern or any other college. So we are excited that you're here today. We thank you, all of our sponsors, all of our speakers, and our panelists. We couldn't do it without you. And Dr. Nilsa Graziani, we thank you. This is her baby. Give her a hand. This is the 6th annual Minorities in Healthcare Symposium, and they're always awesome. So today, 2 things we'd like you to leave here with. 1, a broader knowledge of all of the many opportunities for career and study in healthcare and science. There are so many areas that you can go into. We are only limited by what we expose ourselves to. So students, I congratulate you for being here today. Your teachers, your counselors, whoever brought you, thank you. This is how we widen our viewpoint. This is how we understand that there are more choices for us. So I hope you'll leave here curious enough to look into careers that you may have never heard of before, that our speakers will spark your imagination to study more and to look for that thing that interests you and will drive you. The second thing I hope you leave here today with students is knowing that through these speakers who will share their journey of how they entered into their field, how they made it through. I hope you will know that you can do this too, that there's a wide world of opportunity out there. You can do it. So I hope you'll be inspired today, engaged, ask all the questions that you can, take notes, talk to everyone when you get a chance to in those panel discussions and when questions are asked. Learn everything that you can. I'd like to thank our students who will be presenting today too. You'll see some presentations in the Jerusalem room from some of our own students, and we're really proud of them. Look at your program in the back. I want you to see our sponsors. These are people who are investing their time, their energy, and their resources into you. What does this say? It says that you're worth it, that you're valuable, and that they're interested in you. So I know you'll enjoy your day today. We're looking forward to hosting you, and we're looking forward to enjoying the day with you. So enjoy. And once again, welcome everyone, and thank you for being here.
Hello, how's everyone doing? Are we excited to be here? Good. Anyone here has participated in this event before? And of course, the last few years it was online, but I'm just wondering if any of you participated last year. No? Okay, good. I was going to say, if you did, you'll be, surprised because it's just so much better when it's in person. So our first speaker for today is Dr. Jose Medina. He's originally from Miami, and he's then started to make his way up the East Coast. So he was in Baltimore, where he attended Johns Hopkins and studied public health. And then after graduation, he wasn't sure what to do. So that's normal when you're not sure what to do, correct? You're exploring. So he found himself in the tropics teaching science in Guyana. That experience led him back to Philadelphia, where he got a master's in social work at the University of Pennsylvania. And the purpose was to navigate social and healthcare safety nets, understand that process. After social work, Dr. Medina worked throughout West Philadelphia alongside community health workers, keeping patients in their homes and out of the hospital, working closely with family physicians in this role, and seeing their impact on patients and the community. He decided to become a doctor. Family medicine was an easy choice for him, as he felt it was an area of medicine that shares many core tenets of social work and where he could form lasting relationships with patients. So he trained at Jefferson, and since then he's been dedicated to underserved communities of all types throughout the city and focused on seeking opportunities for residents to get involved outside of the typical clinical and hospital settings. And he is now serving as the faculty advisor for the Jeff Hopes Clinics. So let's give him a hand, and we welcome Dr. Jose Medina.
Thank you, thank you. How do we get the slides up? Oh, they're on it. Oh, perfect, wonderful. So good morning, everyone. My name is Jose Medina. As was just mentioned, I work at Jefferson. I'm a physician. What I do in my day-to-day is right now I'm a hospitalist physician, so I take care of sick patients in the hospital, as well as some of my faculty advising roles with some of the medical students and the residents. And then another important part of my life is that I'm actually in the Army, so I'm Captain Medina as well, and we'll get into kind of a little bit of all this as I tell my story. I just want to say you're about to hear my own personal journey and how I got to where I am in my health sciences career. It's a unique journey, as is yours. So, while I took particular steps and decisions in my training, your kind of path might be a little different, and that's totally okay. So these are kind of some of my objectives for the talk today. I wanted, for you guys to kind of explore a road less taken. My path to medicine is a little non-traditional, so I want you to gain perspective into just all the different paths that might lead you to a health sciences career. Right? Along that way, you're going to find people who are going to help you get there. And those are your advocates, your mentors, and your sponsors. So we'll kind of touch on the importance of all that. Finally, I think a lot of us along our lives will find a passion, something that kind of allows us to get out of bed, stay motivated, keeps us going. It's kind of the why we do what we do. So I'll kind of share with you what my passion is. And then finally, just kind of the importance of paying it forward. We need a more diverse health sciences workforce, so it's important to help the next generation once you already get there. There's an activity that I did throughout my life. First time I did it was in college, through a group called The Place to Talk, which is a peer listening group that my college had. And at the start of every semester, we got together, we had a little kind of retreat day. And an activity during that retreat day was this activity called Lifelines. And basically, it's a recollection, kind of a storytelling of your life. And what's cool about it is it allows you to kind of become self-aware, gain insight and reflection to like who you are, and just become comfortable with your own skin and confident in how we see ourselves. And it's a tool to kind of learn from like our past decisions and events that were significant to us, as well as to help us create a vision for the future. I put a QR code here that actually links to a worksheet that might help some of you kind of walk through this activity. So if you're interested, feel free to like snap a shot now, or at the end I could kind of come back to this slide if anybody wants to do that. And I'm not sure if the slides will be made available, but if so, you could kind of certainly get it that way. So this is my lifeline, right? Obviously it's not every single event that happened in my life, but I think a few key events. One is something that predates me, and that's Papa Medina, my dad. So we'll talk about him a little bit. All right. The worst day ever, which happened in my youth, kind of some of my time in college at Hopkins, sharing about my time in Guyana, my kind of life in Philadelphia thus far, and then what's kind of in my future. So this is Papa Medina. This is a picture of him and I, kind of around 2010. I had kind of just finished a cross-country bike ride from Baltimore to San Francisco, and he actually came out and met the team in California and spent about a week or two with us. He's probably the most important person in my life, and the reason for that is just his own unique journey. I'm Cuban American by heritage. My parents kind of grew up in Cuba during kind of like the turn of the revolution when kind of Castro came into power. Their lives drastically changed, because of who came into power in their home country. He at the time was actually in university at the University of Havana studying chemistry on a scholarship. My grandfather at that time, kind of Pepe Sr., he was a kind of a community kind of activist. He ran a lot of the amateur baseball leagues in Cuba. He was a little like outspoken against the revolution and the new government, and was actually thrown in jail. And because of that, my dad got kicked out of school just because of his affiliation with his own father. So he was kind of stuck. He didn't know what to do. They grew up in Guantanamo, which is actually like the town closest to the like Guantanamo Naval Base, run by the U.S. Armed Forces. And one day, after training for about a year, he just swam into open ocean as far as he could without kind of being like caught by Cuban kind of Navy patrol, and swam into the like U.S. Navy base, asked for political asylum, and was eventually sent to the United States. So he had to start his whole life over from scratch once he made it here. He had to, what he was doing, before as a chemist, he couldn't do that anymore. He started kind of washing dishes in like a New York City nightclub, made his way up to a maitre d', finally found a job in a lab just as an assistant, like washing glassware and stuff like that, where I think one day a supervisor kind of caught him kind of tinkering with machines and was like, wow, are you interested in this stuff? And kind of saw potential and actually like sent him to school. So the company he was working for actually like paid for him to like get another college education, and he again became a chemist, and he actually ended up his career in pharmaceutical chemistry. So, he's someone who is probably one of the most resilient people in my lives, and I think a lot of the fuel and fire and just, him making sure that I stayed on track allowed me to kind of, I think make a lot of great decisions in my life. So kudos to Papa Medina. So the next thing I want to talk about is the worst day in my life. And it was when I was about 8 or 9 years old. My sister was about to graduate college at the time. And she went on a trip with her boyfriend and some friends to Cozumel, Mexico, where she hopped on a jet ski. And, they were kind of fooling around, kind of following each other on the jet ski. And then all of a sudden, a big wave came. This wave knocked her down. She was underwater for a little bit. When she came back up, because her and her friends were following each other so closely on their jet skis, someone hit her in the head. She was unconscious. Thankfully, they were able to resuscitate her a little bit, but they were worried about like a severe head injury, some bleeding in the brain. And, thankfully, miraculously, we were able to kind of airlift her back to Miami, where she got amazing care in the hospital. I remember kind of being young, not knowing what was going on. We kind of raced to the hospital that they were going to bring her to. And I remember we were called outside just to quickly see her before they took her to emergency surgery. And I was standing next to my dad. And the second my dad saw my sister, he just broke into tears. And as we made our way back into the hospital, he just started clenching his chest. He didn't feel good. He looked kind of pale, clammy. He had to sit down when a nurse approached him, and they kind of took him back to the emergency room. So he had a heart attack on just due to the emotion of seeing my sister in the state she was in. So, very quickly, I was about to lose 2 members of my family. My sister to a traumatic head injury, and my dad to a possible heart attack. And thankfully, due to the medical care that she got, and he got, they were both okay. They're both with us today. They're doing great. But I think this was the first time in my life where I saw the potential of, hey, I think I want to be a doctor. And it was just because of just a very real moment in my life where I almost lost 2 family members, and the fact that the life-saving kind of measures that they got were able to keep them in my life, keep them in my mom's life. So as I went through, middle school, high school, I was a pretty good student. I think a lot of that came from just the diligence and hard work and effort that I saw in my parents and kind of supporting for my sister and I. My dad was a big part of that too. And kind of with this idea of wanting to be a doctor in mind, I kind of went to a place that's notorious for kind of being a machine of producing doctors, and that's Johns Hopkins in Baltimore. But as you notice, none of the pictures that I put up here have anything to do with medicine, really, right? It's all about groups of people, right? What I appreciate most out of my college experience was the relationships that I built, as well as just a lot of the service opportunities I had to get to know the community of students at Hopkins, the community of Baltimore itself. And I think service became very important to me. And I was someone who, while I was good in school, I did okay. I hated being in the classroom. I like to do things, experience things. So I think experiential learning, service learning, is something that became very, very important to me. And when I look back on my college years, that's what I get from. So just to highlight some of those things. I mentioned I did a cross-country bike trip from Baltimore to San Francisco. It was a group called the 4K for Cancer that raised money for cancer research. So that's me kind of in Utah, kind of biking down a valley between 2 kind of mountains. This is our team once we finally made it to San Francisco. That's the Golden Gate Bridge. I mentioned a peer listening group at Hopkins called A Place to Talk. This is kind of all our members. I was an RA in college, or a resident advisor. So when you all go off to college, especially if you go away to college, you might have to stay in the dorms. And they're typically senior students that just kind of watch out for you, right? So I was one of those kind of senior students. And then this is a leadership organization in Miami called HOBY, or Hugo Bryan Youth Leadership. And I used to go back every year or two and serve as a facilitator. So that's kind of me still in college working with a group of high school students. The funny thing about my time at Hopkins is that my senior year of college, I actually had my application to medical school all ready to go, prepared. I was about to click submit. And then kind of reflecting on what was important to me, I was like, do I really want to be a doctor? I've had all these great experiences, you know, I really like working with people, right? I like taking care of others, but I'm not sure if like medicine 100% is what I want to do. There are a lot of other things out there that I wanted to explore. So I actually did not submit my application to medical school. I was a public health major, and in thinking about what I wanted to do next, I think getting some experience abroad was important to me. So I, applied to a bunch of like teaching fellowships that would place me in a classroom somewhere in the world. And I was fortunate enough to get placed in Guyana. So this was my time teaching in the tropics. For those of you who are unfamiliar with Guyana, it's a small country in South America, bordered by Venezuela, Brazil, and Suriname. It is kind of culturally more a part of the Caribbean kind of nations in the West Indies, but was a kind of British colony, as a lot of the countries in the West Indies. And just due to its kind of situation in South America, a lot of influence, I lived in New Amsterdam, which is a town towards like the east of the country right here. And just due to our like vicinity with Suriname, right? Suriname actually has a lot of kind of like Dutch kind of influence. So you'd sometimes like hear Dutch, especially like as you get closer to the border. I was fortunate enough to visit some friends down in some of the mining towns in this part of Guyana, and you hear a lot of Portuguese because there are a lot of like folks from Brazil who kind of like travel back and forth and work the gold mines. And then, Spanish is kind of taught, again, just because it's largely part of South America. And then you have all sorts of influences. There are a lot of, Peace Corps volunteers, folks from all over. I think the U.S. had a lot of like military kind of interest in Venezuela, so you'd see a lot of armed, not armed, but very, very large men, and you're like, what are you doing here? And I'm pretty sure there were special forces people kind of taking a look at Venezuela. There's a lot of, I think, influence from China as well. So it's a cool kind of cultural melting pot, if you will. And I had an incredible time, and I think the privilege of like being welcomed by my small community in New Amsterdam, spending time with students, getting to learn from them, learning a little bit of like Creolese, and kind of phrases and things that are very much like part of the day-to-day of living in Guyana. Really enjoyed the food. But I think what I got the most is just how well the community took care of itself, right? You had folks that didn't have a lot, and sometimes were struggling, but it was impressive to see how the community came together to take care of its own. It's a country that doesn't have a whole lot of formal systems of social support, right? Like there aren't a whole lot of like welfare benefits and stuff like that as you might be familiar with here in the States, but people got by, and that was kind of really cool to see. And it was because of, I think, this observation of, right, like how can people kind of thrive, with some, support either from community or external forces or like the government itself, that I became very interested in kind of, well, how do you kind of navigate these systems? And that's what took me back to Philadelphia, right, to social work school. So I studied social work at Penn, and during my time there, really got involved with kind of community health workers and, learning how to navigate the healthcare safety net. So folks who don't have a whole lot of insurance or have no insurance whatsoever, if they encounter kind of medical problems, how can we help get them the care that they deserve and need, and keep them healthy and outside of the hospital? And one of the sites where I learned that was at a place called United Community Clinic. It was a student-run free clinic run by Penn medical students and dental students and social work students and pharmacy students. And in particular, we worked in a church out in the Parkside neighborhood. It's right by like Fairmount Park. And I was just fascinated by what, the power of just a lot of dedicated students who wanted to do good could do for their community. This, experience, right, led me to a career in kind of more like medical case management and social work. I worked for the Penn Health System for a while in oncology, in transplant, and then finally with a program called Impact, which looks for folks who kind of are in and out of the hospital a whole lot and partners them with a social worker and a group of community health workers to help them figure out like all the craziness kind of going on, help them find some stability in their life, connect them to a lot of community resources, and at the end of the day, keep them like healthy and out of the hospital. So, you know, as was mentioned earlier, I interacted with a lot of doctors here, and you know, through this kind of interaction, that kind of little like voice in the back of my head, like, hey, you have this interest in medicine, you know, like you're still kind of here in these spaces, right? Like, is now the time that you want to kind of go through with this and actually finally go to medical school? And I did. So I went to New Jersey Medical School in Newark, New Jersey, where, again, probably like my biggest passion and what got me through the like nitty-gritty grind of medical school was working with an organization called SFHCC, the Student Family Healthcare Center. It was another student-run free clinic run by medical students at my medical school. And I was fortunate enough to kind of run the organization. And you know, that's what kind of drove a lot of my interest into family medicine. Again, service learning, you know, working with my community to kind of solve some sort of health-related problem, while kind of learning all about the ins and outs of primary care, barriers that folks have in getting healthcare. And that led me to family medicine. So I came back to Philadelphia at Jefferson, did my family medicine training. As I was a family medicine resident, again, was involved with yet a third student-run free clinic called Jeff Hope. And, you know, to tell you the truth, it was really due to my kind of love for this organization that I decided to stay at Jefferson. So in other words, like I basically like, I'm doing my day-to-day job just because I get the chance to now like help students as a faculty member kind of, you know, learn all the important lenses I did in kind of community health, community medicine, and community engagement that I did in kind of these spaces. So this is my passion. This is what gets me out of bed every day, right? And I just now love being in the position where I see kind of like students kind of invigorated and wanting to kind of do good in the world and you know, figure out some kind of difficult challenges that we face each and every day of providing healthcare to folks who, you know, are very kind of underserved medically. And, you know, this is a chart that I just want to kind of go over. There's this concept in positive psychology called flow, which is kind of like the intersection between, you know, having to do something that requires a lot of skill and something that's very challenging, right? And, you know, when these things are in perfect alignment, right, it doesn't really feel like you're working at all, right? You're just so kind of like involved and engaged and invested that things almost seem second nature. A lot of like athletes talk about flow states, right? Playing in the Super Bowl, playing in the World Series. Well, you know, health science professionals could also feel flow, and I feel flow each and every time that I like step foot in my clinic. And you know, when I work with my students, right, they're still kind of doing something that's very challenging, right? They're, you know, certainly in their trajectory of developing their skills of kind of being a provider of medicine, right? So they have a lot of anxiety, and it's my job to help them kind of curate that skill so that hopefully one day they also feel that kind of same flow state that I do when I'm there. And finally, that brings me to kind of now. You know, I have a lot of kind of unknowns in my life. So this is my wife, Alina. She's a neurosurgeon at Jefferson. This is us at a Halloween party like last week. You know, she is one of the most amazingly intelligent people I've ever met. She's certainly kind of someone who has been a mentor in my life. She's going to be doing a fellowship in Los Angeles next year. So, you know, I have some decisions to make. You know, am I going to go to Los Angeles? Am I going to stay here in Philadelphia? You know, when she comes back a year later. So my life might change a whole lot, but I'm excited for all the change. I'm in the Army Reserve. Obviously, there's a whole lot of things going on in the world. You know, I have questions of, am I going to be deployed and have to like serve as a physician kind of somewhere abroad? These are my pups being kind of very pensive, you know, also figuring out where we're going to go in life. And just some pictures of my wife doing some crazy surgery. So, you know, what I hope to kind of show you in my lifeline is that, there are so many kind of different ways that you could get to a health services career. And even if you kind of go off on one tangent, things could always change. You could always explore your interests, explore your passions and desires, and kind of decide to jump ship. I had 3 career changes, and I'm a pretty young person. I'm 33, right? I was a teacher, I was a social worker, and now I'm a physician. And who knows, maybe I'll do something else later on. And along the way, I've had a lot of people that have helped me. So, I think these are kind of 3 important concepts to understand, right? There are folks in your lives that you'll meet who are more of like advocates. These are people who are in your corner. They kind of help you get credit for your work. They're wonderful references, right? As you all now think of applying to colleges, some of these folks might be who you ask to write letters of recommendation for you. As you kind of move on, I think you'll start to collect mentors, right? These are people that have a slightly different relationship, right? Typically, there's someone who you feel more connected with, open with. You could share your concerns and your vulnerabilities. Sometimes you kind of might grab a cup of coffee and just kind of informally get to know one another, right? So actually, one of my mentors is the reason why I'm here today, right? So Dr. Diaz is a mentor of mine. I believe he was a speaker last year at this conference. And he's someone who taught me a lot about family medicine and how to be a physician and how to care for like underserved populations in Philadelphia. And due to him kind of not being available, he's someone who kind of vouched for me as someone who, might be capable and willing to come and kind of speak to y'all today. So mentors are folks who, have a lot to teach you and are really committed to helping you kind of move forward. So, my example of Dr. Diaz is someone who might be a mentor. And finally, a sponsor. These are folks who kind of put their reputations on the line to help you move forward, right? This could be your boss, in your future careers, like your CEO, a chairperson who is always looking for opportunities for you to grow, right? So right now in my life, this is kind of like my department chair who, as I'm kind of still learning, how to be a senior physician, is always making me get involved with new projects, new things, so that when it comes time for my like academic promotion, he makes sure that I don't get passed up. So all throughout your life, you're going to meet very, very interesting people who are going to help you each along the way. Some of them might just write you a letter. Some of them might become your friend, your mentor. Others might be the folks that get you kind of raises and things down the line. And this is why it's important, right? This is just a graph showing, at least in medicine, and I'm sure this is a similar trend for other health professions, that even though our population, right, is made up of now getting close to like 20%, if not, 25% underserved minorities, our kind of numbers of students in kind of pre-professional schools, such as medical school, does not meet the population need, right? So once you do kind of find your way, in your health professions career, remember to look back and help those who are on their journeys or earlier on their journeys. And this is just showing kind of like the relationship between, schools that kind of recruit more students from underrepresented backgrounds, and then, those folks later kind of going on to be kind of faculty at those institutions. So schools that recruit more students, from different backgrounds have kind of senior level faculty that mirrors that. So just again, something to kind of put into perspective. So just to close, right, you're like, while there's a general path to your field in health sciences, don't neglect the value of life experiences, lesson learned, and skills obtained that are transferable, right? Even though I was a teacher, I was a social worker, all of the skills I learned along the way are super applicable to my life now as a physician, right? Always ask for help, seek out allies that will help you along the way, find your passion, it's what's gonna keep you going in life, and then finally pay it forward once you make it there. That's it.
Maybe we can have time for one question from the audience. Any student has a question? No? Jasmine, go ahead.
Yeah. I mean, that was a tough point in our lives. I think my mom was a rock. That was helpful. I think a lot of her friends never left the hospital for like days on end. So they were there helping to take care of me when my mom needed, to get some rest or have a serious conversation about the health of my like sister and my dad. So it was really the community around me that just helped me process things, and was there just to support my mom while she was caring for two members of our family.
Thank you. Um, our next speaker is Dr. Beverly Crawford. She's a 1986 graduate of Howard University College of Dentistry, and she is currently at the University of Pennsylvania School of Dental Medicine. She serves as an associate professor in the Department of Preventive and Restorative Sciences and director of the Student Diversity and Inclusion Initiatives. In addition, she is a practicing general dentist in the school's Penn Dental Faculty Practice. In the role of Director of Student Diversity and Inclusion Initiatives, Dr. Crawford has initiated many new programs to increase the numbers of underrepresented minority students and to foster a supportive environment for the dental school's very diverse student body. She directs the Provost Office Summer Mentorship Program for 10th graders, the Introduction to Dentistry Summer Pathway Program for pre-dental students, and co-directs the Penn Residency Education Preparation and Support Program. Dr. Crawford is the co-creator of the Penn Experience, Racism, Reconciliation, and Engagement course now being offered in over 5 Penn schools for graduate and professional students. Her research interests lie in determining the oral health status of students and food insecurity in college student populations. Please help me welcome Dr. Crawford.
Thank you, Dr. Graziani. Good morning, everyone. Good morning, everyone. Yes, I'm going to do that hokey thing where you kind of have you say good morning until we have everyone say good morning. So I'm going to do three things. I'm going to talk about three things today. I'll tell you a little bit about myself and my journey. I'm going to show you how dentistry interacts with diabetes, and I'm also going to talk to you about becoming a dentist, becoming a dental professional. So something very interesting that I just found out when I was sitting next to Dr. Medina. Does anyone hear an accent? Does anyone hear an accent on me? Okay, guess where that accent's from? Guyana? Okay, so I was born and raised in Guyana, British Guyana, South America. And I left at 17 to come to Howard University. And Howard University is like the only university known in my family. So I'm a third generation dentist, which means my grandfather was a dentist, my uncle was a dentist, and they all went to Howard University, and that's where I went to become a dentist. And the only reason I became a dentist was because my uncle said I couldn't, that women weren't allowed to be dentists, that it was too hard. I don't recommend that as a way to choose your profession, though. Okay, so I was a chem major because he said I couldn't do it, and I became a dentist because he said I couldn't do it. So this was 34 plus years ago. So that has changed, and I'll show you a little bit about that when I talk to you about becoming a dentist or a dental professional. Okay, so someone says the oral cavity is the intersection between medicine and dentistry and the window to the general health of the patient. How many of you want to be doctors? Okay, how many of you want to be physicians? Okay, so I see a couple of hands out, so that means you understand that dentists and physicians are doctors. There's always someone, I always look at the patient, the person that I speak to, the high school student, the primary school, the elementary student, and they have a mouthful of braces, and I say, what do you want to be when you grow up? and they want to be a doctor. And I said, what kind of doctor? He said, I just want to be a doctor. But there's someone who is responsible for taking care of your oral health, and that's the dentist. And just a reminder that the dentist is also a doctor. So dentistry and healthcare. So the dentist has now become a critical part of the healthcare team. So usually when you go to the dentist, we see patients, it's all about, I chipped my tooth, can you fix my smile so it's beautiful? My teeth are crowded, can I have braces? Or for some patients, it's about relieving pain. But we now have scientific evidence, scientific research about the connection between oral health and general or systemic health. So now, many times the first sign of underlying systemic diseases can be found in the oral cavity. We can diagnose because we do a very thorough clinical exam of the oral cavity, and we take a very thorough medical history. We ask about not only the physical history, but we talk about the social history as well. And if you protect your oral health by not only practicing good oral health care, but also seeing the dentist on a regular basis, we usually recommend twice a year, then you have a better chance of having not only your oral health problems diagnosed early, but also your systemic or general problems diagnosed. And because of that, with early diagnosis, then treatment is so much simpler, and also you have better outcomes. So having started giving you that little bit of a background between the connection of oral health and systemic health, I would like to just talk a little bit about diabetes, especially type 2 diabetes. So in your oral health, specifically if we have oral bacteria from an unhealthy mouth, that contributes to conditions that include cardiovascular disease, babies with low birth weight after pregnancy, and sometimes pneumonia. Some diseases that might affect your oral health would be if you have an eating disorder. Diabetes, Crohn's disease, lupus, Sjogren's syndrome. Most of these have an oral manifestation. They show one of the things we see in the oral cavity is a dry mouth. The patient has struggling to produce saliva. Now, type 2 diabetes is the way the body regulates and uses sugar. And you need glucose as fuel. Now, we're not really sure. And I think we're working on trying to figure out why Black and brown people, people of certain races and ethnicities, Black, African American, Hispanic, Native American, and Asian people, and Pacific Islanders, why are they more likely to develop type 2 diabetes? Now, we say that the relationship between diabetes and oral health is bidirectional. And what we mean by that is if you have diabetes, then you have sugar, a high amount of sugar or glucose in your blood. And if you have that, it's high in your saliva as well. And then we have bacteria in the plaque in your mouth that's like a sticky film, after you eat. That uses the sugar for food. Now, some of the bacteria cause tooth decay cavities, and some of it causes gum disease or periodontal disease, gingivitis, periodontitis, the whole spectrum of inflammation of your gum tissues. When you go to the dentist, then we might find in your mouth bleeding gums, excessive tooth decay, your breath might smell or taste a little fruity. You have thick and ropey saliva instead of the really good kind that keeps washing your teeth and prevents cavities. And these are all signs of diabetes. So what you have in the relationship between diabetes and periodontal disease is you have hyperglycemia, which you have a lot of glucose or sugar in your blood, and that affects oral health. And then if you have periodontitis or you have an inflammation of your gum tissue, then that affects the way your body can control glucose or sugar in your blood. Now, 1/3 of people with diabetes will have severe periodontal disease. And if you're an uncontrolled diabetic, that makes you more susceptible to developing infections. And then as you see on the slide, you have obesity and other systemic inflammatory disease conditions that are exacerbated by stress and or smoking and poor oral health maintenance. They contribute to the periodontal or the gum breakdown. So here are the different systems that are affected by diabetes. And you can see that periodontal disease is the 6th most common complication of patients with diabetes. So you start here with the patient with the very healthy gingiva, and you'll notice that everything's nice and pink. And then if you look at what you would possibly see on a radiograph or an x-ray, you see the bone level there, and you see nice pink healthy tissue, and it protects the tooth, it's attached there. And as you start to degenerate into severe advanced periodontitis, you notice changes in the soft tissue, it becomes red and irritated, you start to lose bone height, and then as you come down, you see you no longer have that really healthy gingiva. You can see that there are dark areas now appearing between your teeth. And then you start to lose bone, and bone that was up here in the healthy mouth is now down here with a lot of pocketing. And you can see that that's due to a lot of buildup of plaque and tartar. Now, how can we take care of this with dental treatment? Dental treatment can improve the management of diabetes. So what do you need to do? You need to see your dental professional at least twice a year. If you're already at the point where you have periodontal disease, then you need to see the dentist maybe 3 or 4 times a year. Because once we can get that under control, once we can manage that, then we're able to break the cycle of the glucose and periodontitis, and then glucose, high levels, more inflammation, and that cycle that is so damaging to the oral health. What you can do at home is brushing and flossing. So if you notice about the way that you brush your teeth, you'll notice the angle of the brush. It's very important that those bristles come in contact with your gums or your gingiva. So another name, the professional name for gums is gingiva. So you make sure that you angle your brush at sort of like a 45 degrees. And then you make sure that you brush not only the outsides, but the insides as well. And I like to floss before I brush my teeth because the floss loosens up all that soft deposits that might have gotten trapped under your gum. So you'll notice that flossing is not just about putting the floss between the teeth. It's also about making sure that the floss gets under the gum as well. And then after you've flossed, then you can brush, and then we'll be able to control any concerns or problems that you have with your oral health. Okay? Now, we need more dental professionals. So I told you a little bit about my journey, and it was pretty traditional. I went to high school, graduated high school. I came to the US, I went to Howard University. I was a chem major, and I went into dental school. And at Howard University as well, I graduated from Howard University Dental, took the board exams, and started practicing in the Washington, D.C. area. Okay? So now, what do you need to become a dental professional? So it starts with a very strong science background. And if you can do sciences in high school, it's so much easier when you get to undergraduate college, when you see the same material again. It's so much easier, and it makes your college life so much more straightforward. So, and why is it important that students like you become dental professionals? Because, as Dr. Medina was saying, the number of students that are historically underrepresented, that are defined as historically underrepresented minorities. The numbers that students that we have in dental school and in medical school do not match the percentages in the population. You can see this is enrollees by gender. In 2013, it was almost, men were most 52%, women 46%. In 2018, it's more or less, the percentages have changed. We now have more women in dental school. And if you look at the race and ethnicity in 2013, you'll notice that there's been a significant improvement in the number of Hispanic or Latino or Black or African enrollees in dental school over the past 5 years. But it still does not match the number of percentages of the in the population. So the racial and ethnic composition of our nation is projected to change drastically within the coming decades. If we have a diverse health professionals workforce, that's critical to healthcare access for populations, not only access, but the quality of care that historically underrepresented minorities will receive. So dentists, we say that dentists are interdisciplinary pioneers, okay? We work with other healthcare professionals like physicians and nurses. We're family doctors. As I mentioned before, we take, at every visit, we record the patient's blood pressure. We take a very complicated and very deep medical history. And sometimes we are the ones that are diagnosing systemic problems like hypertension or diabetes. We're researchers. We're one of the professions that we're trying to put ourselves out of business. We want to find the cure for cavities and decay. We want to find the cure for periodontal disease. We want to figure out how to regrow a tooth, how to treat periodontal disease so patients, it doesn't progress as quickly and patients don't lose their teeth. We're technology pioneers. What you see here is we now use microscopes in treating patients. This is actually in our endodontic clinic where they do root canals. Because inside the tooth is so tiny, we use microscopes so that we're able to see and do a more thorough job in treating and removing diseases of the pulp or that tissue that you find inside the teeth. And we're advocates. We're advocates for children health care and public health. The intersection, public health is another way where there's the intersection between dentistry and medicine. And if that's not enough, US News and World Report said that we're one of the most respected professions. In high school, what do you need to prepare? You need to take college level or honors or AP or international baccalaureate. You need to take physics, chemistry, biology at one of these levels. You don't have to take AP physics, AP chemistry, and AP. You can take it at the college level because it provides a very good foundation for the dental school prerequisites. It'll help you with your preparedness for dental school requirements. And in some cases, if you did really well on your AP and IB coursework, that can be credited towards your pre-dental requirements, as long as it appears on your official college transcript. When you get to college, you will take these courses again, but now you'll take general chemistry, organic chemistry, English, math, biochemistry, general physics. Many pre-dental students, they choose to major in some sort of biomedical science, but we have at Penn Dental Medicine students who've majored in business, engineering, Spanish, literature. As long as you complete the prerequisites for dental school, you can apply to dental school and be admitted. What are some of the characteristics of dentists? How many of you like to play video games? Okay, how many of you are very good at video games? That hand-eye coordination is off the charts. Well, that's what you use in dental school. Even simply texting. I mean, I've watched my daughter text, and your fingers are flying across those teeny little keyboards at how many words a second, right? If you're interested in the community, one of the things that most dental schools are, they're involved in the community. Their students go into the community to practice dentistry in any of the public health clinics that are available. So hand skills, learn dimensional analysis, leadership, teamwork, multitaskers. You have to be a multitasker because you're sitting in the operatory, and I'm on one side of the patient and the dental assistant's on the other. And there's the tongue and the cheek and the mirror and the handpiece. And then the hygienist pops their head in and says, "Doctor, I need an exam for my patient." So you hear that and you're trying to figure out at what stage can you get up from seeing your patient to go see the other patient in the hygienist chair. So you need to have social skills. Does that mean you need to be an extrovert? No. It just means that you are very comfortable talking to people. You don't have to get up like me and give a presentation, but you have to feel comfortable educating patients about what they need and feeling comfortable answering their questions. Once you get to dental school, 4 years. Now, sometimes you would do 2 years, your first 2 years of education, which is the basic sciences. Some of that you'll probably do with the medical students. You're in the preclinical lab. That is a mannequin there in the handpiece and our faculty. And you learn all the skills you need to work on the patients the first 2 years of dental school. And then you start your clinical training and you become the primary dentist for your patient. Okay, so you're responsible for your patient. Obviously, you have faculty that oversees your treatment, but you're primarily responsible for your patients. Dental school is procedure-driven. You have to be competent in certain procedures before you can graduate. So in preclinical lab, you practice over and over again until you get to the clinical situation where you can do the similar work on patients and not harm the patient. And then at the end of that, you have to take your national and regional boards before you start practicing dentistry. So something that's a little different from being in medical school is that you don't need to do a residency or a fellowship. Once you finish dentistry, you can go into the workforce and start practicing. Although we do strongly recommend that you do a general practice residency or something like that, just to get your speed and your skills up. So, from the American Dental Association website, 10 great reasons to consider dentistry: service to others, a balanced lifestyle, education and prevention, creativity, self-employment. If you want to be self-employed, you graduate from dental school, you open your practice, and you become a private practitioner. Now, let's say you're interested in dentistry, but you don't want to invest, or you're not sure yet if you want to invest the 7 or 8 years that you need to do after high school. Then there are different members of the dental team. We call them dental auxiliaries. You have the dental therapist, the dental hygienist, the assistant, the expanded function dental assistant, the dental technician. And then if you're really into computers, you can work at the front desk and deal with the very hair-pulling insurance companies. So thank you for your attention, and I'm happy to answer any questions you might have.
There's one here in the back. Go ahead.
So your question was what happens after you finish dental school? Okay, so after you finish dental school, you have to take the boards. Okay, you have to take the national boards, and then depending on where you want to go to practice, you have to take the boards that govern that state in which you want to practice.
Okay, very good. Thank you, Doctor. Huh? Oh, okay.
And I think there was one more question. Yes, go ahead.
Ah,
Please.
okay.
So you were asking about my family and their practice of dentistry, and if it was a financial choice versus a passion. So it was a little bit of both. But I liked working with my hands, which is something you'll hear from a lot of dental students. I like just being able to see that the patient comes in pain, and when they leave, they're out of pain, or they come in with a broken tooth, and I fix it. And that's it. It's just, the visit, and you treat the problem, and the patient leaves, and we encourage them to come back for regular checkups and things like that. But financially, it is a good profession. I'm an academic dentist, and but I was in private practice for 2 years before joining academia at the University of Pennsylvania. Yes. Sorry. So I finished high school and I took the SAT and I applied to Howard. Should I? Sorry. Yes. So I left Guyana to come to Howard University, and when I left Guyana, I was 17, and my dad was paying my tuition, and then there was this big revolution in Guyana, and you couldn't send money anymore, so I had to start to work. So it got really complicated after my first year at Howard, but I did have to leave. And then when I finished undergrad Howard and before I started dental school, my entire family immigrated to the US. Thank you very much.
Okay, so we are going to have a presentation now from two of our students here at Esperanza. So let's welcome Jasmine and Anthony.
Okay. Oh, thank you. How does this work? Yeah, I got a clicker. Thank you.
You're all set. Thank you.
Well, good morning, everyone. I'm Anthony Garcia.
And I'm Jasmine DeJesus.
We are both early college students here at Esperanza. For those of you who don't know, early college is basically a program that allows high school students to become full-time college students at Esperanza College of Eastern University. Before I ever entered the college or anything like that, I was always a very patient, I guess, timid kid and never really talked much in school or anything, but now I'm able to be in front of all of you all and now speak. So I would say that the college did something right for me. Throughout my journey here, I've been able to stick to a pretty small community and just grow with them. So now I can kind of call them my own family in a sense, which is why I would say that the true power of Esperanza is the community that you learn to accept as your own community. Due to that, I've been able to strive in leadership, social skills, and overall maturity within the professional and medical field. So as my time here in Esperanza, I've been given many opportunities to meet new people and participate in many different things. So due to that, I've met a few people that are going to be lifelong mentors for me now. An example of that is a Temple Med student who wants to become a trauma surgeon just like me. Forgot about the slides, my bad. And Oh, wait, let me just let this go for a little bit. So those are like us in school and all that stuff. Mind the second picture in the middle. More of us right there just being goofy. Okay, now we're here. So like I was saying, with a Temple Med student currently right now, he wants to become a trauma surgeon just like me. So it kind of helps me out knowing that I have someone that I can rely on and go to kind of guide me in a sense. It was really amazing learning his story and like how he made mistakes and his challenges and stuff like that, and how he wants to implement it. All right, I guess we're switching now. So how he can implement that into my own life and help me out. I know I've like come up with a bunch of challenges and stuff like that trying to get to my goal, since there's many different routes to get there. Knowing that I can go to him and he can like write up a path that fits me is like truly really assuring that I have everything that I need to reach the goal that I want to reach. Uh, this past year, I was the president of our HOSA chapter. Um, for those of you who don't know what HOSA is, it's basically a future health professionals club. We encourage leadership and help each other like learn and get to our goal within the medical field.
Okay, as I started my first semester in the college, I was introduced to HOSA. At first, I was hesitant because it didn't seem like something I would be interested in, but I still went to the first introductory meeting. When I went to the introductory meeting, I found how um, engaging the activities would soon lead up to the state leadership conference. We met weekly to discuss community engagement and service. We also discussed about diabetes awareness. Eventually, the students were able to go to the state leadership conference to compete in their different events. I found the SLC very entertaining because they had different symposiums and presentations for all of us to take part in. At the end of the competition, all of us earned our first place medals. Okay, so now I'm going to talk about if you could please. Now I'm going to talk about our trip to the Philadelphia College of Osteopathic Medicine. We went there to observe different cadavers. I was hesitant to touch the cadavers because it felt weird to touch them because they were processed for so long. Of course, my cadaver had a knee replacement, which surprised me and the medical student demonstrating the cadaver. We also got to learn more about ultrasounds, and I was actually able to see one of my kidneys. And to be honest, it did not look like something I would expect. Going to PCOM was something that I could never forget because it gave me more interest into the medical health field.
All right, so last summer I was able to work with Champions of Hope, Latinos Preventing Diabetes. We were able to be interns for them and work with bringing in diabetes awareness to minority communities like the one you're in right now. We were able to participate in community day events, giving out flyers and stuff like that, basically educating the community. We were able to also volunteer at an orchard and also create an app called Dia Buddy, which is basically an app to help you kind of become healthier on your day-to-day life. So we encourage you to download it and like help us become a healthier community. Knowing that many of us interns were able to have the opportunity to make change and turn it into a reality truly shows like what Esperanza can give you as in resources and motivation to actually do something and impact your community.
Yeah, think that's it for the slides. I have networked myself through Dr. Graziani and Professor Saeed so much, through e-close, guest speakers, and volunteer work, and so many much more. I believe that I've learned to assimilate and grow into the person I am today. Thank you.
Thank you. We also have a word from one of the state representatives from HOSA, Connor McFarland. Let's give him a hand.
Good morning, everybody. My name is Connor McFarland, and I am a Pennsylvania HOSA State Secretary. So at the SLC that those two wonderful HOSA members were at, I was helping to preside over. I was an officer last year, served as Eastern Region Vice President for Pennsylvania HOSA, and we essentially run the State Leadership Conference. So I'm gonna just say a little bit more about what HOSA is. HOSA is a CTSO, which is a career technical student organization that is focused on healthcare. We are building the pipeline of future health professionals, whether that is nursing, physical therapy, dental hygiene, and any other profession that you could think of within the healthcare realm. We are an organization that loves to give opportunity. We have competitions, anything from community service awareness to doing clinical activities in a potential profession that you would like to go into, to community service awards and things like that. We also are huge in community service, as we are a service organization, just kind of giving back to the communities that helped put us where we are. This year I serve on an officer team with 4 other members who are spread out across Pennsylvania. So we are representative of the entire state. And one last thing is, kind of like the 2 presenters were saying, we run a state leadership conference in March, maybe the beginning of April, so that is where everybody from Pennsylvania can come and compete. They can talk and network with other members, as well as get more opportunities through, like they were saying, symposiums, exhibitors, and stuff like that. And then they were, as they said, they got first place medals. So when you get a medal or a top 3 at states, you also qualify for International Leadership Conference, which luckily I had the honor to attend. It was in Nashville, Tennessee. This happened in June, and that's pretty much where, if you place at states, you get to go compete on the national level. I believe there were some 10,000 HOSA members from across the world. We have representatives from China, HOSA, Canada, Puerto Rico, America Samoa, as well as the continental United States. So HOSA opens doors. It can help you unlock your potential, shatter your expectations, and help you go beyond all limits. Thank you.
Thank you. So we are scheduled to have a break. We are running a little bit behind. So what we're going to do is, how about everyone gets up? If anyone needs to go to the bathroom or do need to take a very short break, you can do it. Otherwise, let's just do a stretch and keep going, because otherwise I don't want to run out of the time for the activities, which is what I know that you're all really looking forward to. So stretch, and again, if anyone needs to go to the bathroom, please go ahead and do so. We will get started with the talks though right away. So just stretch in place if you can. If you need to go, go, and then when you return, be very quickly and quiet coming back. Can you put the presentation up?
But whenever you talk and you have that mic, keep it. Don't give it over to him. Okay. Do you have this program? So we'll use mic 3. I'm sorry. I will get you. I will get you up. We need batteries. Number 2 is going to go on the stand. Number 2 has to.
All right. Thank you. Very good. So we're going to watch a very short video, and then we will keep going with the presentations. Thank you.
I was 43 when I found out I had breast cancer. I'm here today because of Fox Chase. They do the research, the genetic testing, the drug trials. All they do is live and breathe cancer. They saved my life. I was 43 when I found out I had breast cancer. I'm here today because of Fox Chase. They do the research, the genetic testing, the drug trials. All they do is live and breathe cancer. They saved my life.
And let's give a hand to Fox Chase, one of the sponsors for the event today. All right. Okay, so I am your next speaker. And I'll try to keep it short because, again, we're trying to make up time. I want for you to be able to get to those activities. And the topic for my presentation today is the challenge is on. And the challenge that I'm talking about is, we're going to talk about some challenges and how you can make a difference. So when we look at the past, there's many people within underrepresented groups that have made a big difference in the health and in the medical fields. Women, other underrepresented minorities, Black and brown people that have made a big difference. They've been pioneers, and it's been very hard for them trying to work in an environment that maybe has not been very encouraging to them. Today, because we are still celebrating the Hispanic Heritage Month, we're going to stay and talk more about, or concentrate and focus in Hispanics. So we're going to talk about the significant contributions of Hispanics to the field of medicine. So we have here a few, can't stay put. Two of these very important people, Dr. Carlos Finlay from Cuba, who was one of the first to realize that mosquitoes were transmitting yellow fever in Cuba, which was causing a lot of death. So this was very significant, and it happened in the late 1800s. From Puerto Rico, we have Dr. Antonia Novello, who actually was the first woman and also the first Hispanic to ever hold the title of U.S. Surgeon General, and this happened in 1990. Now, we have a lot of Argentinians that have made this sort of like top of the list. Bernardo Alberto Husay won the Nobel Prize in Chemistry in 1947. He did studies on the role of the pituitary hormones in the regulation of blood sugar. And then René Favaloro was the first surgeon ever to perform a coronary bypass, and this was back in 1967. Luis Federico Leloir won a Nobel Prize in Chemistry in 1970, and this was on his studies on how carbohydrates convert energy in the body. And then Cesar Milstein won the Nobel Prize for Medicine in 1984. He developed a new way to produce monoclonal antibodies, and he used, which are used to treat some cancers and autoimmune diseases. From Mexico, we have Luis Miramontes, who's developed the synthesis of the norethindrone pill, which is a contraceptive pill, and this happened in 1951. From Venezuela, we have three gentlemen. Humberto Fernandez invented the diamond scalpel in 1955. Baruch Bernazarov won also a Nobel Prize in Medicine in 1980, and he discovered the immune response genes that determine if a transplant organ will be accepted or rejected by a recipient, which of course has big outcomes. And then Jacinto Convet was nominated for a Nobel Prize in Medicine in 1998, and he developed a vaccine for leprosy. From Colombia, we have Dr. Manuel Patarroyo, who developed the first synthetic vaccine for malaria. It is now inactive. And then Severo Ochoa is from Spain, and he won the Nobel Prize in Physiology or Medicine in 1959, and he discovered an enzyme that enables the synthesis of RNA. So these, again, all people that have accomplished big things. Now, again, that's the past. How about the present? We are working in a situation where the health field minorities, such as African American, Hispanics, Native Americans, even though we make up about more than a third of the US population, we have less than 10% of the physicians represent these groups. At the beginning of this decade, there were roughly 3,000 Latino patients for every single Latino doctor. And of course, things like issues of language and cultural differences can affect the patient's care. If you cannot communicate with your physician, it's going to be very hard to understand what's going on or to even follow the treatment the way that you're supposed to do. So there is a big need for a more diverse workforce in healthcare, and I think you have heard and will continue to hear that throughout the presentations today. This is because you need that diversity to be able to better serve a diverse patient population. And NIH, which is the National Institutes of Health, they would like to promote diversity in the fields of biomedical, behavioral, clinical, and social sciences, and in the research. So how many of you have heard about health disparities? Okay, very good. So these are the definition, these are differences that exist between different groups in terms of reaching their full health potential. So why is it that this group over here can reach a better health than this group over here? Okay? These health disparities sometimes are caused by health inequities. One example of this is the Hispanic or Latinx population in North Philadelphia has the highest rate of diabetes at 23% here in Philadelphia, which is a really high rate. And the message that I want to get through is the fact that we cannot focus only on the problems, correct? We have to focus on the solutions. What can we do to fix a problem? We cannot, some problems are really big, but each one of us has the power to do a little bit, correct? So that's what I would like to encourage you to do. You, as our youth, can make a difference, okay? So I want to talk about our Champions of Hope Latinos Preventing Diabetes project. And Anthony mentioned a little bit about that since he was involved in the project. But this is part of a bigger program called Cities Changing Diabetes. And that is sponsored by Novo Nordisk, one of the sponsors here of the program today. And as part of the Champions of Hope Latinos Preventing Diabetes program, we had a focus on youth. And some of the things that the youth were involved with include a diabetes club that met weekly. We also had a summer internship program, and we helped develop this Diabody app. So, so here we can, where's my pointer here? Okay. So these are some of the students actually during the internship learning about healthy eating. We also had some speakers that met with us. Some of them actually, this case was a virtual presentation from a dietitian. We also, oops, sorry. Oh. Sorry. I'm moving the wrong direction. Okay. The students had the opportunity to receive CPR training, and this is the marketing materials for our Diabody app, which again, just like Anthony mentioned, I strongly encourage you to join our effort and our movement by downloading the app. So these youth champions, that's how we want to call them, or how we like to call them, the youth champions, they were involved in writing articles for the Impacto newsletter. They participated in health fairs and community days. They did a lot of work preparing some educational materials, and also we volunteer working in an orchard. These are some of the educational materials that they prepared, and some of the students that were involved in this are actually here, which is really wonderful to have them here. So that's the present. How about the future? So just like we encourage these students, I want you to think about what can you do, correct? Because at the end of the day, the future is you. So what are the things that you can do to, follow your dreams? You've heard about stories today about how important it is to follow your dreams. You need to continue your academic career. What steps will that take? It's not always going to be easy, but if you have a big why, you will be able to accomplish what you set out to do. So the other thing is to seek out any opportunities that you have to enhance your education. You've heard today about the Champions of Hope program. We do have some of these internship opportunities where not only for students that are part of the Esperanza family, but also for students in the community at large. You're all here. You're taking the advantage of this opportunity of being here today. You've heard about HOSA, and there's other clubs just like HOSA that you could belong to that will allow you to, again, grow and academically develop. So take advantage of all of these opportunities. And the most important thing, believe in yourself. That's super important. If you believe in yourself, you will become unstoppable. Okay? And again, I said I would be fast. We're trying to make up some time. I don't know if there are any questions. I can take a few questions. Any questions? All right. Well, give me a second. So let me introduce our last speaker of this morning, and Dr. Wishita Leng. He is the resident. He is a residency-trained pharmacist, having completed his pharmacy doctorate program at Wilkes University in 2006 and his residency training at Lebanon VA Medical Center in 2007. He also holds an MBA from Temple University's Fox School of Business and a certificate in epidemiology and biostatistics from Drexel University's Dornsife School of Public Health. Wishita has been with Novo Nordisk for over 3 years. In his current role within medical affairs, Wishita engages with national healthcare quality measure stakeholders to advance patient care and clinical outcomes. Prior to coming to the pharmaceutical industry, he has over a decade of experience as a pharmacist, clinician, and population health strategist in diverse healthcare settings, including as the Director of Population Health Pharmacy Strategy at the Delaware Valley ACO in the Greater Philadelphia region. Let's welcome Dr. Wishita Leng.
All right, I'm gonna go right through this. I'm gonna take this. Can I take the mic off? Is that cool? No, leave it. Don't touch it. All right, I won't touch it. All right. All right. I'll just do my hands. Keep it right here. So my name's Wichita Lang. I'm with Novo Nordisk. Great to be here. I'm gonna go through a couple different parts today and really kind of talk about my journey, how diabetes, the uninvited guest, kind of invaded our household, invaded our family, and a little bit about the background of pharmacy and pharmacology. So a little bit about me. I grew up in a town called Lebanon, Pennsylvania. There's more cows than there are people, I believe. And my parents came from Cambodia in the 70s during the Civil War. So my dad kind of was able to escape with his life. He lost all of his family, came with a duffel bag. My mom came with most of her immediate family and a larger suitcase, but really came with nothing. Throughout that journey, it was really an interesting household where it was half Cambodian speaking and half the time you're speaking English. So there's this like hybrid of languages, and getting into the public high school in Lebanon, it was really assimilating was difficult at times because you're in kindergarten, first grade, and people aren't necessarily eating rice all the time at lunch, and the language is always in English, and some of the words you don't quite know. So going through that public high school was interesting. But after high school, I went to Wilkes University, again from 2000 to 2006. And in Pennsylvania, I was fortunate enough to do 2 years of undergrad plus 4 years of graduate and able to get my doctorate in 6 years total. And that, you can get in with an undergrad with 4 years of undergrad and then apply to pharmacy school as well. And I know in Pennsylvania there are several pharmacy schools, even in the local Philadelphia area. But I went to Wilkes University in Wilkes-Barre. And then afterwards, I wanted to really get a little bit more skills, hands-on skills in that clinical application, working in the patient-facing role and working in a different setting, and go a little bit beyond kind of what I was exposed to and learned about in pharmacy school. So I did an extra year of pharmacy residency at the Lebanon VA. So I went back home, had to live with my parents. They were fine with that. And then did the residency training, which was pretty intensive and rewarding, concentrated. That 1 year was like 3 years. So what I'm going to do is I'm going to take a step back and talk a little bit about the career journey too. And this helps to inform kind of where my journey of academics and professional career start to intersect. So I graduated from pharmacy school and went into residency. Did a year in the hospital, filled the orders, checked the orders in the computers, walked with doctors around doing the rounds, and was able to move into an emergency medicine clinical position. And in that role, that was like blood, guts. You're working in the ER, people with car accidents, people that have like asthma attacks. And what you start to realize is there's a lot more visits to the ER that are associated with regular old chronic diseases than there are from those traumatic things that you typically see on a TV show about ER medicine. And I ended up working much closer, or as close with the social worker and case manager on the floor as I did with the physicians. And there was this kind of aha moment, like there is so much more to the healthcare system that I wanted to learn more about, be exposed to. And going to the public school in Dornsife at Drexel was really to better understand the biostatistics and the epidemiology and understand some of the aspects of the population and why people keep coming. Why don't they just take their inhalers? Oh, well, they can't afford their inhalers, or they don't know how to take it, or they keep it in their car and then it doesn't work anymore. So there's so many different factors beyond just the right medicine for the patient. And then how does our public system support or hinder public health? So there were so many aspects that I wanted to pursue and understand about the things I was seeing in emergency medicine. I moved into the Philadelphia area in about 2012, and in that role I worked for an insurance company, but in a clinic that was based in North Philly and West Philly, and I worked side by side with other physicians, social worker, case managers, and it was a tough population because these are the folks that would use the ER as their primary care, and our job in these clinics was to help manage conditions that were really manageable if they were just able to be supported a little bit more in their primary care efforts. So in about the 3 years working for that company, Cigna HealthSpring, at the times Bravo, is now Cigna, I learned that there's a lot more to the business side. So you learn a bit about the public health side, the intersection of social and health. Then you move into this managed care organization, this insurance company, and you start to see there's a business aspect to it too. So I wanted to learn about what are the drivers of the business of healthcare. And then I started to pursue at Temple, Fox School of Business, a part-time MBA while having one child, then another child, and having 3 job transitions. So it was a fun time. So I ended up doing a ton of work, which was totally rewarding, and was able to get my MBA without my wife killing me. And she was totally supportive, so it's good to have family support. But now I'm working at Novo Nordisk and really applying all of those different things from business to clinical to strategy and public health into a role that's really encompasses more than just healthcare, medicine, and the pharmacology products that we deliver at Novo. So just a little bit more background. Again, my dad and my mom, they came from Cambodia with nothing. I was born in Lebanon. So my dad was in the banking industry. My parents owned a sewing factory. So how did I get into pharmacy? There's absolutely no logical reason that somebody that has no healthcare background would get into pharmacy. And my journey into healthcare was kicking and screaming. So my dad had recently lost his job in the late 90s, and we had a sewing factory that was doing all right, but in the late 90s, a lot of the work that we were getting in the sewing factory went overseas and went to different lower paid countries. So we actually lost the business. We had unstable job, unstable income. And I told my dad, you know what I want to do, Dad? I want to be a writer. I want to write books. I want to do journalism. And I was the oldest of 3, so I was pretty much the third parent. And they were like, that sounds nice, but do you like to eat? Do you like to be able to feed yourself? Because you're not going to be able to do that with us. So, not having anything to go back to really was, aha, I'm like, okay, well, all right, I'm going to have to figure this out. So during the first few years of pharmacy school, it was very tenuous, tough times back home. So I kind of at times felt guilty for being away, being at school. A lot of the financial strains at home carried itself over even if I wasn't there, because the student loans I took out would go back home to help them support the household and get food for my brother and sister back home. So there was a question around did you pursue healthcare because of the passion or the finances? And this was really, at the beginning of it all, was a financial decision because we had nothing to go back to. I'm going to go back here. So that was really the biggest driver into how I got in here. But as you saw in the previous slide, there's so much more than what I even was aware of, because all I was aware of was the CVS down the road, and I'm like, that's the pharmacy, that's what they do. I'm going to go to school and get debt, and I'm just going to go to that pharmacy down the road. But there was much more, and that's why I'm still in healthcare. The piece of it that becomes the uninvited guest is that throughout the later parts of high school, probably where you guys are, and into early college, my dad actually started experiencing the symptoms of diabetes, and he was actually back in Cambodia for a few months doing some work there after he lost the job at the bank. And he was not having like the worst health, and he was like in his late 40s, and he didn't really seem like he was unhealthy when he went over. And he noticed when he came back and told me stories about how he kind of felt diabetic over there, he would tell me stories about how he would go to the bathroom. And in Cambodia, there's not really like, at the time, there wasn't like toilets, there's holes in the ground. You still can go, to the hole in the ground. But he noticed there were ants kind of accumulating around his urine, and what that meant to him was like, there's a ton of sugar coming out of my body. So that a little bit freaked him out. So that was one of his first experiences with it. And one of the things you don't get when you lose all of your immediate family in the war and you come back by yourself is you don't get a family medical history. You have no idea what your risks are, and you just kind of start living through life, and you're like, oh crap, I have diabetes. Oh man, now look at this, I'm losing this. So this was all new to him. There was no experience with healthcare in the family, so we weren't able to manage it and like lean into some of the health literacy that I may have now. But these are the symptoms he felt, and he had a physician who treated him as a primary care physician, but at times my dad wasn't honest with him. He's like, oh no, I'm just feeling a little tired. I think I'm just not sleeping. But he knew he wasn't feeling well. He wasn't honest and open with the physician, to the point where he was prescribed the medicines. They did the labs. They understood that his A1C and his sugars were high, and he's at risk. But at the time, he was still taking his meds sometimes, and he didn't fully appreciate what could happen with unmanaged diabetes. So this happened while I was in school. He had his first heart attack of, I think he's had 3 or 4 now. He statistically should be dead, but he's still alive. And he had his heart attack. He had a stent placed in 2005. He had another heart attack, and he had open heart surgery in 2014. And then, he's defying the odds. He came back from a war. He didn't die. He got diabetes and got a heart attack and had like 3 different surgeries, and he's still not dead. So like, I don't know what he's doing to keep himself alive, but he's really like proving a lot of these stats to be like the other side of it. But he had his heart attack, and in pharmacy school, that started to mean a little bit more to me. It became a little bit more intimate. And I said, there's an opportunity here to now leverage this pharmacy career or pharmacy education and really strengthen it towards an interest of diabetes. Like, I don't want to see my dad die again or get a heart attack again. So it really helped to find like somewhere to like latch onto and say, okay, I may not necessarily want this career out the gate, but this is how I'm going to make it my own. This is how I'm going to mold it. Another piece of it too is when you have diabetes, there are other risks in addition to the heart attack, and you can actually end up with blindness. And he only had one good eye because he lost one in the war. So he had one good eye, and what he experienced in 2004 was all of a sudden there was this gradual cloudiness in his only good eye, and he ended up over a very short but slow progressive period losing half of his field of vision. So he can't see anything below like his nose down, and he only has one good eye. And I think that was right before the heart attack, the first heart attack, and that really freaked him out. And I think that's when it was kicked up into, okay, I'm going to get on the right meds. I'm going to keep doing what I do. And that only gets you so far, too, because there's lifestyle. I mean, we are in Asian households, high rice consumption. I mean, bags and bags of rice. So like our holiday gift from my aunt and uncle the other year was bags of rice. I'm like, this is great, thank you. So like it is part of the ingrained culture. So the counter education of diet and exercise didn't really work for him, and he was relying on those medications. And at the time, the therapies were what they were. There wasn't a ton of innovation in what was being delivered. And he ended up stable now, but I think going to pharmacy school and kind of bringing it back home allowed me to help create recommendations for his medical plan, get him on the latest therapies that were most relevant. The evidence-based guidelines usually take 5 to 10 years before you see it adopted in a physician's practice. So we were able to kind of accelerate that for him and just kind of get him on the right meds. And that's thanks to the pharmacy training. I was able to bring that back home. And even now, if my grandma has issues or my other aunts and uncles have issues, they'll call me and kind of consult. And they trust the educated one that's in healthcare. And I mean, it means a lot to me to be able to stand up for them and help them advocate when they're experiencing those stress points, and not just a physician visit, but my grandpa died during COVID. So to have them understand what technically or medically was happening and bring it back home, that was really helpful to be able to deliver that for them. So I want to also define pharmacy and pharmacology. So pharmacy is kind of where you work, what you do, it's the profession. And then pharmacology is the study of the interaction between molecules, medications, and the living bodies or living systems. So when I think of pharmacy, I was thinking, you know, there's where you work in a retail pharmacy setting. You're working at CVS, Walgreens, Rite Aid. And I did that for a time. I did that part-time to pay the bills through college. And you know, that was a great job, but I also, you know, didn't know what else was out there. So then I ended up working in a hospital setting. And in the hospital setting, you're in the hood, you're checking IVs, you're creating these different concoctions in the back room. You're also working in computers to help support physician orders and make sure that everything gets processed smoothly and that the right medicine goes out of the pharmacy and into the patient. So there's different aspects of that I was able to do. And rounding on the floor, I had the greatest opportunity there to interact with people in different disciplines. So we had new grads, residents, physicians that have been hospitalists and internists, but we had a really diverse group of people seeing different patients at their illest. And that really taught me about how healthcare is a team sport. And it's not just like, I'm the pharmacist, this is what I do. It was, we're all gonna be thought leaders together and share our diversity and thought in helping to advance patient care. So if you like standing and walking around and being in the hospital setting, there's room for pharmacy to practice there too. Being able to be in a clinic, I also worked for Temple Health for a while and was embedded in a couple different Temple PCP offices, even one down the road here, and really seeing patients with physicians in their office. And if you go into a PCP office, a primary care office, they're typically just, their books are full. They're probably seeing more patients than they physically and possibly could in any given time. So there's opportunity as a pharmacist to come in and support some of the lower level of risk patients, those that just need a little bit more medication tweaking. So it's a pretty rewarding job because you get to see the patients longitudinally or over time. So they're not just there in the hospital and then they leave. You're kind of helping to co-manage patients' medications. And that was a really good environment. In addition, too, there's opportunity to come in from a different side as a consultant lens and really help different practices create more efficiencies around medications, or consult the health system, which I did at Temple and the ACO, or as a strategist role, to help them understand what are the opportunities in the patient population as a whole. There's a lot of data that I learned how to do, and Excel became something I got more comfortable with. But you know, that ability to kind of uplift the practice beyond that single patient and move into this more systemic approach. And then there's the business side. So right now I work for a pharmaceutical company. There's opportunities to own your own pharmacy. You can work climb the corporate ladder in various settings. So there's the insurance industry, there's the drug company side, there's the distribution channels, there's tech, now there's farm tech. Just a few years ago, we had PillPack, which was a pharmacy delivery system bought up by Amazon. So healthcare is a very fastly innovative and changing field, and I think so long as you're in the profession, you understand the healthcare landscape, you're able to solve problems that are near-term present, that are new, or haven't been invented yet, or haven't been created yet. So the ability to be agile with healthcare background can take you into tech, can take you into financial investing, can take you into corporate ladders. So it's more than just any of these things, it's all of these things. Pharmacology, this was a tough class for me. So I wanted to be in like creative arts, and I took pharmacy school, and it was very tough, totally different than writing sentences. So the left side, what you see is I don't know how to use the laser pointer, but there's a little red ball on a little curved line thing that looks like a hand. So that's what we would call like a receptor, and there's a molecule that hits it, or a medication that would hit that. And part of what we try to do in pharmacology is understand, like, what if we mess with that a little bit? Or what if we send some other molecule that looks like that native molecule, and how do we accelerate or decelerate or stop some of the processes that happen further down the chain in that system of what happens in your body? So that's kind of that study between the molecule and the living body. And on the right side, ADME, if you go to pharmacy school, ADME will mean something to you. But the absorption, distribution, metabolism, and then excretion of any product. So what we want to understand is if you take a drug, if it comes into you through your skin, if it comes in through your cheeks, you swallow it, you inject it, however you administer it, what does it do in the system? So we have to understand if it goes into the gut, if it goes into your intestines, it's going to be absorbed one way. Some of it gets lost. Some of it doesn't make it all the way through. It gets through the liver, or you could bypass some of that metabolism and go directly into the blood through like an IV or an infusion. So the liver's job is then to take that out of the bloodstream, clean it out, pull out all of the, process it, pull out the metabolites, and the kidney ultimately will excrete it, or it comes out and you poop it out. But it is part of that whole system that we need to understand how much of a dose do we need to give, how does it distribute in the body, how long does it last in the body, what are the side effects if it lingers too long, or what other things would interact with it from a system-wise. So that's pharmacology in a nutshell. And to get that little molecule that would be effective on that little ball over there on the receptor, so oh man, I built this out so slow. Hold on. This is the drug discovery timeline. This seemed like a good idea when I made it come out really slow, but all right, sorry. So to get that one drug in your body that's doing something appropriate, I'm gonna walk backwards from the right side to the left side. So the FDA says you got this new drug, so today we launched a new drug, and it's gonna work, and it's gonna reduce this, and it's gonna fix that. Well, it took about a year to a year and a half before the FDA gave you that stamp of approval. So you had to bring paperwork to them. They had to review all the studies that you did, and they had to say, yeah, this is sound science. We're gonna go ahead and approve that, and here you are. You can go ahead and take it to the market and create those really corny drug commercials that you see every day. So you can do that now. Before that, there's about 5 to 7 years where you're doing studies to say what's an effective dose where we're not causing more problems than we are curing the disease, and what are the benefits and the risks. Then you do another study, say what's the right dose. Then you do another study onto that, and you say like what's the statistical significance? How much of a population do we need to get on our therapies before we start seeing one person change? So those years and years of recruiting and following up and keeping patients like true to the regimen and studying it and keeping that scientific soundness, that could be 5 to 7 years. And then you're starting off with a few compounds and whittling it down. Before that, you could have hundreds of compounds, preclinical, that you're doing in lab rats or other animal models to really understand what those molecules could be doing, any ones that give you a chance at commercialization or market success. So those preclinical stages are just as important at helping to get a better educated guess as you select the final 5 to put millions of dollars into to run these trials. But even before that, you have thousands and thousands of molecules and compounds that may not even make it to the bench, to the lab. So to better appreciate this, it's whatever we got approved today might have taken 15 or more years of research and back-end work to get to. So you could start off with tens of thousands of compounds just to get that one compound over 15 years. And I think all of that was new to me too when I came over to the industry side, is just how long and time and resource intensive these molecules take to come out and have the kind of success that we're seeing with some of the products. So that's it. I think I did it. Yeah, we're close. We're close. But any questions? Yes, sir. Yeah, the questions about the 2+4 program at Wilkes. Yeah, so I came in as a pre-approved or guaranteed seat in the program, so long as I didn't get below a certain grade point average in the 2 years of undergrad, which I did. I had to regain that seat, which was a horrible experience too, because then you're like competing for the same seat you just had. But yeah, the 2+4, you come in, you pre-interview, you show them your SATs, your transcripts, and you say, I have the potential to be a great graduate, and yes, sir, I do like this school very much, and I would be loved to be so you do all the stuff that you need to do. You get the 2 years, you satisfy those requirements, you essentially can easy pathway into the 4 years, so long as you follow through. The hard way I did it was like, you didn't really do that great in organic chemistry, so now you're like gonna have to go through and find ways to really compete against another crop of graduates that just got their 4-year degree, and then you go back in. So there's always different ways to get in, but yeah, you're gonna be able to get that 2 + 4. Question? So I don't have a PhD, I have the PharmD, but I did do a research project in my residency, which was related to how physician prescribing is influenced with report cards. So if you show report cards to physicians and they see how their other physicians in their group are prescribing and how their outcomes may or may not be improving, that actually motivates humans as a people to kind of better step up some of the things that they're doing, whether it's following different guidelines or seeing different kinds of patients or changing something. But having something that says, you're not doing as well as so-and-so, it's a competitive fire under the butt and driver. That was the research project I did. All right, cool. Thank you.
Thank you. All right, so I hope that you've learned a lot from this morning talks. We will move now we are going to go up to the 3rd floor to Esperanza College. You are assigned to different spaces. Your ambassador from the college is probably going to be here to accompany you, but we're going to dismiss in a specific order. So if the students from Esperanza Academy, if you can please stand up and head to the door. And remember that you have your assignments on your cards, on your badges.
Some pictures with you when you get them developed. I saw all these great people taking pictures, and I'm not very good at it, so I was like, thank you, wonderful.
All right, next, if we can please have Abraham Lincoln High School.